Hello, in this video I'm going to be talking about the immediate postoperative period after a mastectomy and how to regain your strength. Before I go on, I want to invite you to subscribe to our channel. We're always putting out new content and refreshing some of our older content so that it is as up-to-date as possible. And I'd love to invite you to go to Yerbba.com to get your personalized report. A mastectomy, as you may know, is removal of the breast. We used to, in the old days, also remove all the muscles under the breast. That's no longer done. Now what's done is a modified mastectomy, modified radical mastectomy. We don't do radical mastectomies, but very, very rarely. When the lymph nodes are removed, that's a complete mastectomy with lymph node removal, and what I'm going to talk about applies to either simple mastectomy or a mastectomy with removal of the lymph nodes. Everything I say is included. In the immediate postoperative period, the first few days, you're going to have some pain. I would like to say discomfort, but it will be pain. It's very possible that your surgeon did a nerve block into the axilla, the armpit, and what that does is it helps numb the area for quite a while. After that, the pain can actually get a little bit worse when that nerve block wears off. You will be sent home from the doctor's office, from the operation, with instructions on how to manage pain. And we've had some other videos about the immediate post-operative period. In general, we don't need to give much more than a couple pills of a stronger acting narcotic analgesic. People who have a reconstruction, with their own tissue, will need more pain medicine. If you haven't had a reconstruction, it's very likely you can get away with just a couple of tablets. You are likely to go home with a drain. That's a very squishy tube that goes in the area of the surgery and it keeps fluid from accumulating. You'll get instructions on how to manage this, and you'll also get instructions on what you can and can't do with your arm. What I want to move to now is once you have the clear to start moving things, moving your arm and shoulder around, I'd like to talk a little bit about what you can do to regain the strength that you had. So one of the first things you'll want to do is work on your range of motion. You want to avoid getting a frozen shoulder. Let's say you have pain in the armpit and you don't move the arm, or you move the arm like this by tilting your body over. That's going to freeze your shoulder. So once you get the okay to do so, you want to start moving your arm away from your body. And you'll see I'm using my own hand, and that helps. You may have somebody, a friend that you trust, who can help you. That's called guided arm exercises, where somebody is helping, and you can see the point at which you get stiffness or pain. At that point, you want to go just a little bit further, not to the point of excruciating pain or tearing feeling where you had your surgery, but just a little bit more. Every day you can do a little bit more, and you'll be amazed at how quickly you regain your range of motion. You can't really start to do strengthening exercises till you're more comfortable with your range of motion, even if it's not completely back to normal. As I mentioned, you'll get some exercises. One of the things might be creeping your fingers up a wall. And what you want to do is keep your shoulder down and stretch that arm on the side of your surgery. So you can see I'm not tilting my body to climb the wall. I'm just raising my arm. Then you want to start doing that abduction, abduction, where you move the arm away. And you can start moving forward with bicep curls. You're not building muscle, you're just building some strength. And then gradually increase the movement and range of motion and the amount of weight that you're lifting. Start with a soup can and move up. Studies have been done, and limiting arm motion and strength training increases lymphedema. For years, doctors told patients, don't move your arm, don't lift anything, don't do heavy work, you can't be an athlete anymore. And then a randomized trial was done showing that lymphedema was worse in people who froze their arm. And we know if you just did an experiment now where you didn't move your limb for a couple days, it would start to get full with fluid. Just not moving it leads to lymphedema. So it's really important to mobilize the arm and do strength exercises as soon as you can. Again, you'll get instructions from your medical team, but in general, more is better. And especially if you were super strong before, to gradually increase to where you were under the guidance of your medical team is appropriate. If you're struggling with this and you can't do it without some support, a physical therapist can be very helpful. So can an occupational therapist. So a lot of physical therapy and occupational therapy groups are combined. And occupational therapists know how to manage arms after surgery and a lymph node operation, like many physical therapists. Not all, but many. So don't worry if you're sent to an occupational therapist. Another thing that can help you regain your strength is low impact cardiovascular conditioning. That can be a brisk walk, or it can be doing yoga, something that gets your heart rate up. This actually increases strength overall, especially in our core muscles, our back muscles, and that will help you get stronger in your arms as well. Now, I'm going to say something that may not be relevant. If you already had surgery, this isn't relevant. But if you're about to have surgery, one thing that I'd love to recommend is something that's called prehabilitation. This is not covered by insurance, so it's not really taken off. But basically what it means is preparatory to surgery, get as strong as you can. So if you're about to have surgery, getting as strong as you can. Let's say it's 5 days, who cares? Do 5 days of lifting and exercise and strength and flexibility exercises. All of that will help you recover from surgery and get stronger afterwards. If you haven't heard about this and you've already been through surgery, it's not you and it's not your medical team. This just hasn't taken off in people having breast cancer surgery. It's been shown to be very effective in people getting abdominal surgery and bone marrow transplants, other settings. I don't see why it wouldn't work in breast cancer, and wanted to give you that option if you're preparing for surgery now. I've covered a lot. I hope it's been helpful. Any questions or comments, put them in the comments below. We get back to you within a couple weeks, just as soon as we can. And as always, thank you for watching.